Okay, good evening, ladies and gentlemen. If you can take your seats so that we can kick off on time. Thank you. So if you can just take your seats, there's still open seats around. Great, thank you. So good evening once again, honorable guests, ladies and gentlemen, all protocols observed. Thank you for coming to this event. It is not my job to issue the welcome remarks. I'm just the master of ceremonies, so I'm just going to introduce myself. I'm Robert Maturu. I'm the director of programs at Unitaid. Unitaid is one of the co-chairs alongside the Global Fund of the new Global Oxygen Alliance, and I'll be serving in that capacity for Unitaid. But tonight, it's my job to keep things on track, to introduce all our distinguished speakers, to make sure we get through the first session on time before we can begin the second session, which is the reception, for which we also expect more guests. So without further ado, it is my great honor to introduce Her Excellency Anne-Claire Amprou, who's the Global Health Ambassador for Health from France. Bienvenue, Anne-Claire. Merci.
Yes, it works. Mesdames et messieurs les ministres, mesdames et messieurs les ambassadeurs, chers invités, chers amis, c'est avec un très grand plaisir que j'ouvre ce soir cet événement d'Unitaid, ici à la mission permanente de la France. La crise du Covid-19 a démontré à quel point l'oxygène médical est essentiel et sauve des millions de vies chaque année. Et pourtant, il reste difficilement accessible dans certains pays, et notamment les pays à faibles et moyens revenus, où les besoins sont énormes. La pénurie mondiale d'oxygène, au cours de la pandémie, a suscité un extraordinaire mouvement de mobilisation internationale pour en faciliter l'accès à tous les pays et s'attaquer aux barrières qui en limitent son utilisation. Nous pouvons dire aujourd'hui que cette mobilisation à laquelle vous avez tous contribué a été un succès et Unitaid a joué un rôle particulier dans cette aventure. Et je l'ai moi-même vu lors d'un déplacement au Rwanda, à Kigali, en décembre dernier, avec la présidente du conseil d'administration. Nous avions visité un hôpital et ce n'était pas complètement prévu. Nous avons visité un service de pédiatrie où de bébés étaient pris en charge. Ils souffraient de tuberculose, mais ils avaient accès à l'oxygène grâce à l'action d'Unitaid. Et ça fait la différence dans la prise en charge de ces bébés. Alors, une résolution sur l'amélioration de l'accès à l'oxygène médical est sur le point d'être adoptée cette semaine à l'Assemblée mondiale de la santé. On pensait qu'elle le serait cet après-midi et que nous pourrions l'annoncer ce soir, mais l'agenda était un peu retardé et donc ce n'est pas encore le cas. Ça le sera dans les prochains jours, c'est une question d'heure. Mais c'est intéressant de revenir sur cette résolution qui doit favoriser l'investissement dans la production d'oxygène, son approvisionnement, son accès équitable au niveau mondial, régional et national, entre toutes les parties prenantes. Et cette résolution montre notre volonté collective de tirer les leçons de la crise que nous venons de traverser et de poursuivre le travail titanesque entrepris ces dernières années. Le lancement de la Global Oxygen Alliance marque la pérennisation des activités menées jusqu'alors par le groupe de travail d'urgence sur l'oxygène d'ACTA, qui était dirigé par Unitaid depuis février 2021. Et ce groupe de travail a investi plus de 83 millions de dollars pour améliorer et accroître l'accès à l'oxygène à usage médical dans les pays à revenus faibles et intermédiaires. Et grâce à vous, des millions de vies ont pu être sauvées et je tiens à saluer votre engagement collectif sans faille pendant la crise et au-delà. Vous êtes nombreux ce soir pour cet événement et donc sans plus attendre, je passe la parole au docteur Nabil Gower et Robert Maturu qui vont pouvoir partager quelques éléments complémentaires d'introduction avant de céder la place aux différents experts au cours des différents panels organisés ce soir. Merci d'être ici. Je vous et je nous souhaite un bon événement intéressant et qui, encore une fois, est un exemple de ce qu'on peut faire pour changer la vie des patients et leur prise en charge. Donc bravo à vous et bonne soirée à tous.
Great. I'd like to thank Her Excellency Ambassadrice Anne-Claire Amprou for those welcoming remarks. I'd now like to invite on to the stage two of our next speakers, Dr. Nabil Gohir, who's the Chief of Asia, Middle East, and the European region for PATH, and Lisa Smith, the Director of Access to Medical Devices Portfolio, also at PATH. So Nabil, if you could come up straight to the podium. Lisa, if you could take a seat, and then you can come to the podium after Nabil. Thank you.
Thank you, Robert. Excellencies, honorable guests, ladies and gentlemen, a very good evening and bonsoir. Am I hard at hearing? Bonsoir. Do me a favor, with this, do me a favor, perhaps do yourself a favor. Take a deep breath. We have been busy and tired in WHO meetings. Let's appreciate that oxygen is life. Keep breathing. I'm here today to talk about three things: our struggle, our alliance, and a global resolve. Not to talk about these three things, but also to celebrate it. Let me start with the struggle first. It took us almost 10 years of hard and smart work to get where we are right now. And unfortunately, a pandemic as well. I salute each and every one of you in this room for your dedication, devotion, and determination. The world now knows that access to oxygen is access to life. I must say, on our own, we were rather invisible, and together we have become invincible. Let me now move on to our alliance, Global Oxygen Alliance. Unitaid, WHO, and PATH, and all our partners. I see us as a group of fighters. We're a different kind of fighter. We fight not to take lives, but for lives. One child dies every 45 seconds due to pneumonia. 2,000 die every day. Access to oxygen can be the difference between life and death. We have every reason to be proud of this alliance, which will be contributing to saving lives. I thank our partners for being with us. And last but not the least, the resolve of this word in the form of a WHO resolution to increasing access to medical oxygen. As Madame has noted, we are getting there. We are almost there, and hope we get this good news soon. It will be an important milestone in this journey of saving lives. We have fought a good fight together. Let's not slow down. Let's make it sustainable. In PATH, we believe that with the right mission, inclusive innovation, and respectful partnerships, we can make this world a better place. Yes, we can, and we are. Congratulations again. We shall keep calm and carry on. Thank you.
I'll be rather quick. A lot of friendly faces in the audience today. My name's Lisa Smith. I am PATH's Access to Medical Devices Portfolio Lead, which contains all of our oxygen investments. For the last decade and more, Path has been working in the oxygen space, and today's event holds special significance to me, as Path had the pleasure of hosting the first oxygen convening in 2017. At that time, there were delegations from 9 low and middle income countries, along with partners, donors, and industry members. At this year's Global Pneumonia Forum, there were 14 participating countries, each of which made ambitious commitments to oxygen and pulse oximetry access. Today, with the support of Unitaid and WHO and many others, we have leadership from over 25 low and middle income countries in attendance. This is a testament to the increased awareness, commitment to act, and country ownership of oxygen access. And it makes me both proud and humbled to be a part of this community. The resolution, the launch of the Global Oxygen Alliance, and all of the investments and partnerships that have been established to date make me hopeful that we can achieve universally accessible medical oxygen. So I'll leave you with my sincere thanks for your interest, your commitment, enthusiasm for this important issue, and the work that remains ahead. We're happy to partner with you all. Thank you.
Thank you very much, Dr. Nabil. Thank you very much, Lisa, and thank you to Path for helping co-organize this event, and also more importantly for the work you've done on oxygen access through this pandemic and before. It's now my great pleasure to introduce our 3 distinguished speakers for the high-level opening remarks. I'm going to invite each one up to the stage as I introduce them. Our first speaker will be Dr. Charles Olaro. He is the Director of Clinical Services in the Ministry of Health of Uganda. Thank you, Charles. If you can come up onto the stage and take a seat. I'll now also introduce Dr. Atul Gawande. For many of you, he needs no introduction. He's the Assistant Administrator for Health at the Bureau in USAID. Thank you, Atul. And our third speaker, who also probably needs no introduction, is Dr. Mike Ryan, Executive Director of WHO's Health Emergency Program. So Mike, if you can come up to the stage as well. So, Dr. Olaro, you're going to be the first up. Before you start, just a few rules of procedure. You're all very distinguished gentlemen, but I won't hesitate to stop you if you go over. So, Dr. Olaro, you'll have 4 minutes or so, Atul and Mike as well. So if you can kick off when you're ready. Thank you so much, Dr. Olaro.
Your Excellencies, distinguished guests, ladies and gentlemen, Uganda led the effort in proposing the just approved resolution on increasing access to medical oxygen by the World Health Assembly. And this was prompted by the challenges of inadequate access to medical oxygen, which was made worse by the COVID pandemic. Medical oxygen is essential life-saving medicine for management of hypoxemia, which presents because of several diseases along the course of affecting mainly vulnerable groups, the children, pregnant women, and the elderly. Therefore, increasing access to medical oxygen benefits many ongoing global strategies and plans, namely the Average Newborn Action Plan and the Integrated Global Action Plan for Prevention and Control of Pneumonia and Diarrhea. The other one is Global Strategy for Women, Children, and Adolescent Health 2026 to 2030. The WHO Global Action Plan for Prevention and Control of NCDs 2023 to 2030, among others. So the implementation of the resolution is imperative our efforts in accelerating towards universal health coverage. The resolution therefore urges member states to have national oxygen plans that prioritize adequate oxygen infrastructure, equipment, and ensure adequate oxygen supply that meets the demand of the national plan, which should articulate the quality assurance, the supply chain management, the human resources, and the capacity and the financing and research. So Uganda expresses the commitment in implementing these resolutions and welcomes all the support towards achieving this. I think our membership in this room shows really all that support. So adopting the resolution is a major milestone. However, it's only a signal of the work ahead. So Uganda recognizes the need for the initiative, the Global Alliance, to coordinate the implementation of the resolution to sustain the gains. We pledge our commitments to work with the newly established Global Alliance. And we take this opportunity to express our gratitude to the member states for the support at every stage, that led to adoption of the resolution. And a special thanks go to the contribution of the Lancet Commission on Medical Oxygen Security, which was chaired by our own university, Makerere University. And also we want to thank the health sector partners for their continuous support in oxygen. Notably, I will not mention all of them, the Global Fund, the Clinton Access Initiative, PASS, and the UN agencies. Let us not lose the opportunity created by COVID pandemic to push ahead with the reforms that will drive performance and value creation across the global oxygen health ecosystem. Thank you very much for listening.
Thank you very much, Dr. Olaro, and we thank the government of Uganda and the Ministry of Health for the leadership you've shown on this issue, particularly in co-sponsoring the resolution, which we hope will be adopted tomorrow, and also providing leadership of the Lancet Oxygen Commission as well. Dr. Gawande, over to you.
I would also like to share my thanks to the government of Uganda for not only being a co-sponsor, but being involved in the drafting and impetus behind the resolution. This is a critical moment. I want to make sure to thank, however, our host, Ambassador Bonifant, and the government of France, Unitaid, WHO, and PATH. So many of you were here before the rest of us came on board, and it was a lonely time, and I know how far you have come, and this is an amazing moment for you, where and for all of us who have now joined the fight. The resolution incorporates oxygen, increasing access to medical oxygen, as a part of the comprehensive universal health coverage agenda. And second of all, it comes at a time of the establishment of the Global Oxygen Alliance, of GOAL, as they've called it, all vital to ensuring the next steps in advancing beyond an emergency response that really scaled this work and establishing this and institutionalizing this. Before the pandemic, we more or less treated oxygen as a luxury for the world. And that was despite pneumonia being the #1 killer of children ages 1 to 5. That was despite tuberculosis, a respiratory illness, being the biggest infectious disease killer in human history. But COVID, the threat, and then the actual reality of it, brought many more of us on board, USAID being one of them. We came to recognize early in the pandemic that this was our single most effective therapeutic remedy for COVID, and that we could talk about monoclonal antibodies and a variety of other things all we wanted. We needed oxygen. And that led us down a learning path that brought investment of over $100 million, that brought oxygen capacity to over 150 countries in our own work. And it was a learning process where we went from enabling the delivery of small cylinders at large scale, then to oxygen concentrators and finding that they don't have an adequate supply of concentrated enough oxygen, nor the capacity to provide large-scale delivery, to then the delivery of small on-site oxygen generation plants, PSAs, and then finally bulk liquid oxygen, where you were starting to create an entire oxygen ecosystem. These included places, for example, like Ghana, where it started with 4 health facilities where USAID installed PSA plants that had the capacity to produce 250 liters of oxygen per minute, enough for 25 severely ill COVID-19 patients to be cared for per facility per day. Since commissioning in September of 2021, we estimate north of 9,000 severe adult COVID-19 patients have been treated thanks to USAID investments and others with serious respiratory illnesses, and critically, our partnership with the government of Ghana. Since then, we supported the development of 11 health facilities with 2,600 beds to use bulk liquid oxygen, which allowed them to have much larger capacity and even support oxygen infrastructure going out into the broader community. As we look at where we are now, we are continuing down those paths, but also working with partners like CHAI and others around market shaping, This is every bit as much a part of the localized regional manufacturing objective as when we talk about vaccine manufacturing or drug manufacturing. And as we explore the work on how to capacitate medical oxygen, it was a recognition, as I was just discussing earlier with partners from CHAI, that it's not the big international firms that are going to be the critical players here. It's the regional and national players that we have to capacitate in order to drive oxygen prices down that cost 10 times or more what it costs to deliver oxygen in higher income countries. I look forward to all we're going to learn from the technical experts in the course of our discussion, but especially also all of you who we are encouraging to join in our US commitment to support this resolution, to participate in goal, and to continue to contribute to ensuring that everyone has the oxygen they need to breathe.
Thank you very much. Thank you, Dr. Gawande, and we thank USAID and the US government for its leadership in the COVID response and the technical as well as significant financial support for oxygen access. It's now my pleasure to invite Dr. Mike Ryan as well to speak.
Great. Good evening, everyone. I'll just start by telling you a story that's very personal to my heart, because we've all been through the hell and back at every level in COVID. My office was particularly hellish during the last 3.5 years. But actually, as it happened, outside my office on the way to the lift was where the biomedical oxygen team worked. And they were there when I came in the morning, sometimes at 6. They were always there when I left at night, sometimes after midnight. And it was a ragtag collection of people from WHO and UNICEF and PATH and Unitaid, UN Ops and others that came together. And that was reproduced all over the world, groups of people coming together, activists, biomedical engineers, logisticians, our logistics team, trying to find a solution. Because what we learned early in the pandemic, that in effect, COVID was a human pathological model of inflammation combined with hypoxia. An inflamed lung, your oxygen level drops, and there's a period of time in which supplemental oxygen can get you through that. Before we had vaccines, before we had monoclonal antibodies, before we had anything else, we knew that there were certain things we could do if we could get fast enough to the right patients with the right intervention. Supportive clinical care, oxygen, good intensive care, and then ventilators and others to deliver mechanical oxygen when the patient just could not do it themselves. It was a very simple thing, but it was one thing that became very evident very quickly. We couldn't do it. We couldn't do that simple thing. And we saw images of people fighting over oxygen canisters in major cities because we couldn't deliver a single life-saving intervention. But those who did try, those who managed to make it all work, are my heroes. And particularly because they sat outside my office for that first 1.5 years and showed what partnership can do. But people who just throw away their badges, take off your institutional badge and work together to find solutions. And I think that's one of the proudest things I remember. So it's very close to me because it was so close to me day to day. We're really proud in WHO to continue that partnership. We started off with the Biomedical Oxygen Consortium and the group that came together around the O2 Scale-Up Initiative. But thanks to Unitaid and others for the leadership of bringing the Oxygen Task Force together inside the Act. And that took it to another level. And now we have this whole process of not bringing oxygen to the world that do, but taking that aside. Anyone who's worked as a frontline clinician like I have in the front line, losing a patient because you don't have oxygen is one of the saddest things, be that a pregnant woman or a young child. But the world has woken up to the value of oxygen, and we've woken up to the fact that we can actually deliver it. I'm very, very proud to work with Yukiko, who's joined us, with Clive on our side, and with Adriana Velasquez, another hero, silent hero of this whole process, who's worked tirelessly. We're really proud to be part of this process. We're really proud to see what has been achieved. with PSA plants, with ventilators and other things. And we've seen, and I think the one thing that I've seen in terms of the installation of bringing this idea of oxygen self-sufficiency into countries is we've seen it in the high mountains of Bhutan, we've seen it across the SIDS, we've seen it in countries in deep conflict like Ukraine and Somalia. We can do this everywhere. There's not a context in which this has not been done during this pandemic. Not a single context. We just haven't done it enough places yet. And we haven't done it sustainably, and we haven't done it in a way that it can be done across all diseases. So it's a very special day, and there's going to be hopefully a specialer day tomorrow when the World Health Assembly comes together and energizes this whole thing with the resolution. Our thanks to the government of France for your leadership in this, to our colleagues in Unitaid particularly for your leadership in this. And with that, I'll just finish up. Oxygen saves lives, but we need to get oxygen to where it can save the lives, and that's our biggest barrier. Thank you.
Thank you so much, Mike, and thank you for your indefatigable leadership in this pandemic. You're actually off the hook, and so I allow you down. Thank you, Mike. Thank you, Atul. Thank you, Charles. So again, thank you to all our speakers for the welcome remarks, the introductory remarks, and the high-level opening remarks. We're now going to move into the first of two panels in the next hour. And the first panel is going to be member states who are going to be brought up. And the panel will be moderated by two esteemed ladies who are leaders in their own right in many things, including oxygen access. So I'm going to introduce our moderators first, and then each of the speakers. So we'll start by inviting Adriana Vázquez Perumen up to the stage. She is the team lead on medical devices and in vitro diagnostics at WHO. Adriana, if you can come up. And then Janet Diaz. Dr. Janet Diaz is the lead clinical management and operations unit, country readiness strengthening in the WHO Health Emergencies Program. So Adriana and Janet are going to be moderating this next session. So I'm going to call up each of the speakers in turn. I have the pleasure to invite Dr. Nomi Wisława de Pawłowski Amiel. I'm sorry for butchering your name, but I'll just call you Dr. Amiel. If you can come up to stage. She's the director of the General Office for International Technical Cooperation in Peru. And then I'd also like to invite Dr. Damba Kadka. He's the medical superintendent in the province hospital in Surkhet, Nepal. So Dr. Kadka, please come up to the stage. And then we have Mr. Dabsu Guidosu, Secretary General of the Ministry of Health in Chad. So if you can come up to the stage as well. Great. And we were hoping to have two others, but I don't think they've managed to arrive in time. The Acting Director General of Health in the Ministry of Health of Kenya and the Minister of Health in the Democratic Republic of Congo. So we'll kick off in the interest of time, and hopefully they can join for the rest of the proceedings. So over to you, Janet and Adriana, to moderate this session. Thank you.
Bonsoir et merci beaucoup à la France pour nous recevoir ici. Thank you very much, specifically to Uganda for proposing this important milestone resolution to be highlighted in the global agenda. Together, we need to ensure that medical oxygen is affordable, available, and of good quality for use in a variety of settings, including for emergencies, for infectious diseases, for non-communicable diseases, as well as for general health services, and a special focus on children with pneumonia. Personally, I had a personal experience with my son. He had really sick with pneumonia when he was 2 years old. So I made my commitment and said, we have to be passionate and never let a child die because of lack of oxygen. So WHO really invites member states to consider all the guidance documents that we have developed. And as Mike said, it was really a great commitment between all of us. Janet's team and my team and everybody was working together with Pat Chai and all member states and all biomedical engineers all around the world in extremely fast way. have never seen that before. And we did the priority medical devices for COVID-19 and associated technical specs. That contains 100 devices and 100 technical specs. And we made them like in 3 months, never ever before. And they were translated to 6 languages. Ale developed the PSA technical specifications with other colleagues. Ale is there. And that was wonderful. And also the foundations for medical oxygen systems, which was released very later recently. And we will always remain attentive to all the countries' needs and that we can address jointly. None of us can do this alone. WHO is required and motivated to continue developing guidelines, specifications, and training materials to meet the needs of health systems, particularly in those low resource settings. As an example, I just want to bring 2 great examples. The Open WHO course on medical technologies for oxygen delivery we have 16,000 people that have taken that course. And that course was made out using a mobile phone. In different countries, we had about 100 people from different countries filming and then making the videos. Then we did it. And it was also with Janet's team. And also the WHO Clinical Care Channel for COVID has enrolled over 57,000 people and is available in Arabic, Bulgarian, English, French, Portuguese, and Russian. So then we saw that we really can make a huge impact. Of course, WHO will continue to call for innovative technologies for low resource settings, which you know we have already been doing. And last but not least, will support the development of policies to increase access to oxygen. Needless to say, we are here to serve member states and to welcome any effort to join forces from all stakeholders with all the helps with now through GOAL, the Lancet Commission, and everybody that's here towards ensure no patient is left behind without oxygen. So now let me give the floor to Janet. And we will be doing some questions for our country representatives. Over to you, Jen.
Do these work? Is that okay? Okay. Good evening, everyone, and a warm welcome. It's my pleasure to be co-chairing, moderating this event. So I think we could start, maybe if I can give the floor, the first question. We have a series of questions, and sometimes it's just general remarks, but we do have a specific question for now we're going to start with Dr. Dambar Khadka. So Dr. Dambar Khadka is the medical superintendent of Provincial Hospital Surkhet in Nepal. And Dr. Dambar, what we want to hear now from you is your experiences, because we want everyone to learn from each other's experiences, because that's how we're going to build this work in the future. So tell us about the innovative oxygen solutions that you use to scale up oxygen in Nepal at your health facilities. What could others learn from your experiences?
Can I speak from this? Thank you very much for that question. First of all, I want to thanks to all, ladies and gentlemen. I am from Nepal. Oxygen, such a gas, which is freely available throughout the world. If we cannot get 3 to 5 minutes, we'll die. We are getting free of cost. But in the hospitals, in the ill patients, it is very necessary and it costs. In our part, as a result of oxygen crisis faced during the COVID-19 pandemic, before 5 years, we had a 115-bedded hospital in each province. The UNOPS and the WHO helped a lot. UNOPS, in every province, they installed 2 oxygen plants. And in our hospital, WHO installed solar plant. For that, we are getting very beneficial for that poor people and the patients. Oxygen scale-up was undertaken throughout the country. Installation of PSA plants was one of the approaches with which rapid escalation of oxygen was achieved. We achieved. As of today, there are approximately 126 PSA hospital-based oxygen plants in the country with a net production capacity of oxygen equivalent to 10,555 J-sized cylinders per day. Likewise, there are 20 to 29 liquid oxygen storage tanks with a total storage capacity of 582.5 tons of liquid oxygen. Similarly, there are about 30 private oxygen gas producers with a capacity of 18,555 jet-sized oxygen cylinders in per day. Some of the critical approaches that can be taken to create a uninterrupted medical oxygen supply in our country. Number one, devising strategies to manage PSA plants. For that, the capacity of the newly installed PSA oxygen plants was chosen, considering the surge requirement. The investment was massive, but however, these systems are ideal in many places because of the low regular oxygen requirement. One of the valuable lessons learned in the COVID-19 pandemic was to ensure the availability of oxygen in the country is a scale larger than the everyday need. Therefore, it is extremely important to strategically manage these underutilized plants to ensure the availability of the oxygen, especially during the increased requirements in the country. Likewise, number two, developing regulatory framework to ensure quality of better management of oxygen, medical oxygen. Number three, exploring solar energy to power PSA generator. 3 months back, WHO, which was installed 150 kVA solar plants. Likewise, there are many hospitals in remote parts of the country where the PSA generators are being powered off using diesel fuel in the absence of stable grid electricity. Solar energy could be a beneficial and effective alternative sources of electricity to expensive diesel fuel that is currently being used for powering of oxygen plants. Photovoltaic solar energy generation system was recently installed in my province hospital, Surkhet, is a pilot project to reduce the electric expenses of running the PSA plant. Number four, addressing private oxygen producers is a key point. Lastly, enhancing knowledge base and good maintenance practice. For that, we have holding a training of technical staff is of utmost importance. Recently, the Ministry of Health has developed a training package entitled Basic Training of Medical Oxygen System. Rollout of this module promises to establish entire group good practices. Thank you very much.
Thank you so much. That was a wonderful example of all the hard work that was going on in Nepal during these times. Adriana, can I give you, we have the next panelist.
Bonjour. Alors, Excellence, vous avez établi dernièrement 2 centrales de production d'oxygène à Bangor et Mondu, d'une capacité totale de 609 mètres cubiques par heure chacun. Elles desserviront pratiquement tous les hôpitaux du sud du pays qui devaient auparavant parcourir de longues distances plusieurs fois par mois pour obtenir l'oxygène de la capitale, Najema. Comment cela a-t-il changé la situation du Tchad et comment prévoyez-vous l'impact sur des autres maladies ou traitements? Et une deuxième question, le ministère de Santé, le ministre de Santé a-t-il des ingénieurs biomédicaux qui travaillent pour soutenir cette nouvelle alimentation en oxygène? Merci.
Merci, pour la question. Je voudrais juste rappeler que contrairement au Népal où on a pratiquement des unités par hôpital, ce n'est malheureusement pas le cas au Tchad. L'essentiel des centrales de production sont concentrées en N'Djamena. Et donc, c'est grâce au partenariat avec l'OMS que nous avons réussi à installer 2 unités de production, une à Bangor et la deuxième à Mundu, d'une capacité chacune de 69 mètres cubes par heure, comme vous l'avez rappelé. L'objectif visé à travers ces installations, c'est de rendre disponible l'oxygène au niveau de ces provinces du sud du pays, mais également de pouvoir décentraliser un tout petit peu au lieu d'avoir toute une concentration au niveau de N'Djamena. Il faut se dire que par le passé, il fallait venir s'approvisionner en N'Djamena et là, la chaîne est très longue. Il fallait attendre 4-5 jours, voire même une semaine pour que les différentes bouteilles soient chargées. Donc, grâce à ces 2 installations, on se rend compte maintenant que les hôpitaux au niveau du sud du pays peuvent s'approvisionner facilement au niveau de N'Djamena et de Bangor. Quel est l'impact? Premièrement, à travers ces installations, il y a une amélioration nette en termes de temps d'approvisionnement. Au lieu de mettre 5-6 jours, voire 7 jours, on peut s'approvisionner désormais au lendemain. Le lendemain, en 24-48 heures maximum, on peut déjà s'approvisionner parce que ce sont des provinces qui sont pratiquement limitrophes et donc les distances entre les villes ne sont pas assez grandes. Et ça facilite effectivement cet approvisionnement-là. Le deuxième volet aussi, c'est que il y a eu une amélioration dans la qualité de la prise en charge. S'il fallait se rendre d'abord en N'Djamena pour attendre une semaine et revenir, le malade qui est en détresse respiratoire ne peut pas attendre 3-4 jours avant que l'oxygène ne lui parvienne. Donc, avec ce rapprochement-là, il y a eu effectivement une amélioration de la qualité de la prise en charge au niveau de ces structures. Le troisième impact aussi, c'est que dans ces zones, dans ces hôpitaux aujourd'hui, on ne peut pas mourir parce qu'il manque encore de l'oxygène. L'oxygène est déjà disponible. Donc, on a quand même réussi à faire reculer un peu le mur de ce côté-là. Le quatrième point que je trouve également assez important, c'est que par le passé, c'était l'oxygène, on retrouvait essentiellement au niveau des unités de soins intensifs par rapport à la COVID. Mais aujourd'hui, on le retrouve également dans d'autres services comme la maternité, comme la pédiatrie, mais également comme le bloc opératoire. Je voudrais faire remarquer qu'au Tchad, aujourd'hui, on a un décès maternel par heure. Et donc, pour une femme qui est en détresse respiratoire, évidemment, si l'oxygène manque, ça contribuera encore à aggraver un peu la situation. Il faut faire remarquer aussi, comme quelqu'un l'avait dit en introduction tout à l'heure, quand l'oxygène manque, le personnel de santé est pratiquement malade parce que vous voyez bien le patient en train de mourir sous vos yeux, mais vous n'avez pas d'autre possibilité. Mais avec cette disponibilité de l'oxygène, on est arrivé à faire baisser le niveau de la létalité, surtout au niveau des structures qui prennent en charge les cas de Covid. On a fait baisser ce niveau de létalité de 7,5 à 2,5. Par le passé, la létalité était l'une des plus élevées en Afrique centrale pratiquement. Donc maintenant, on en rejoint pratiquement les autres avec une létalité estimée à 2,5. Donc ça libère un tout petit peu le personnel qui était stressé pendant longtemps à cause de cela. Donc voilà un peu ce que je peux dire par rapport à cette première question. Mais je voudrais surtout insister sur le fait que c'est grâce à l'appui de l'OMS, surtout à la représentation pays de l'OMS à travers le représentant résident qui non seulement apporte l'expertise nécessaire, mais qui est pratiquement notre conseiller, qui est tout le temps au ministère, qui a demandé même à ce que tous les experts soient plutôt au ministère au lieu d'être dans le local de l'OMS. Le leadership du docteur Jean Bosco, je crois, il va falloir le répliquer un peu partout en Afrique pour que les différents pays puissent tirer le plus grand bénéfice. Donc, pour cela, nous lui reconnaissons au moins cette qualité et nous tirons chapeau véritablement à l'OMS. La deuxième question, est-ce qu'on a des ingénieurs biomédicaux? Je pense que toujours avec le soutien de l'OMS, nous avions constitué des équipes de 4 personnes qui ont été formées et qui devaient s'assurer du suivi au quotidien du fonctionnement de ces machines. Mais en plus de ça, le ministère de la Santé publique a identifié un ingénieur biomédical qui travaille en collaboration avec l'expert de l'OMS pour s'assurer de la bonne marche de ces différentes machines au niveau de ces provinces qui sont éloignées, l'une de 236 km, l'autre pratiquement à 500 km de N'Djamena. Mais l'OMS ne s'est pas seulement arrêté à ce niveau. L'OMS appuie actuellement le ministère dans le cadre du développement des directives de bonne gestion de ces unités de production et d'oxygène, mais également dans le cadre de la pérennisation des acquis, il est prévu, toujours en collaboration avec l'OMS, de faire en sorte que les capacités du personnel soient effectivement renforcées. Et une fois que ces capacités sont renforcées, lorsqu'on va ouvrir encore d'autres unités de production d'oxygène, on pourra s'assurer que la partie nationale pourra désormais prendre le relais. Donc voilà un peu ce que nous avons comme expérience du côté du Tchad à partager avec vous. Et je crois qu'on peut compter sur le partenariat, on peut compter sur la solidarité internationale pour que ce désert qu'on observe aujourd'hui au Tchad soit vraiment comblé et que les larmes des Tchadiens puissent se sécher. Merci beaucoup.
Merci beaucoup, le ministre et du Tchad, et pour partager avec nous l'importance de l'oxygène pour élever la qualité des soins des services de santé. Alors, Janet?
So my pleasure to now give the floor to Dr. Normi Weislawa de Palilowski. Amiel, you have a long name. Director of the General Office for International Technical Cooperation of Peru. And for you, the question is, can you describe to us one specific transformative experience that propelled action towards increasing access to oxygen in your country, Peru? So thank you.
Thank you. Thank you for the introduction, and thank you for the invitation to be part in this wonderful event. And thank you everyone for your attention. For background, in Peru, the responsibility for the procurement, application, use, maintenance of medical oxygen system as appointment by individual hospitals and healthcare networks. As a regulatory entity of the matter, the Minister of Health designated medical oxygen of 99 to 100% concentration in gas form for inhalation as essential drugs. Thus, until 2020, only oxygen in this concentration was permitted for medical use. However, there was only 3 companies authorized to sell in the Peruvian market. As we can remember, there was a sudden exponential increase in oxygen needs by the population as a result of the COVID-19 pandemic. According to estimated by the Peruvian Minister of Health, during the first and the second wave of pandemic, there was a deficit of 70 metric tons of medical oxygen per day, which contribute to the poor performance of the Peruvian healthcare system and was evidenced by the mortality rate of almost 68 deaths for 10,000 inhabitants. One strategy employed by the Peruvian government that transformed access in Peru was the authorization of medical oxygen by concentration of 93% of graded. This allowed for incorporation technologies to which achieve 95% of oxygen purity. With this strategy, our supplies increased from 38 oxygen plants with authorization to sell oxygen in June 2020 to 265 plants in June 2021. As today, we have 427 plants in Peru. Now, the emergency measure due to the pandemic-19 has been lifted. Our country does not have the oxygen deficit, and we are capable of satisfying the needs of the population. This strategy was successful due to the joint effort of the Minister of Health, the private sector, and the civil services society working in tandem. Thank you.
So I'm going to say a few words, and I want to first just thank our panelists. Everything that they have shared has been incredible, and I think we all know we have the same stories in our own countries. It was indeed a relentless period for governments, communities, and all other stakeholders when we were responding. And again, just to highlight the work between the Biomed Consortium, the O2 Oxygen Task Force, but really also everyone in the countries, the workforce, the biomedical engineers, the biomedical technicians, and the clinicians. And I know everyone here has been struggling because they saw when they didn't have oxygen and the patient died, and that was awful. And Mike said that at the beginning. And with oxygen and delivered appropriately, safely, rationally, correctly, then lives are saved. So it is, everyone's story sees the same outcome, and which is why we're here today. So we want to avoid that communities have to experience these difficult experiences again. And so if we've achieved this all thus far together, it means that we continue working together, we can achieve much more. And so this is what the resolution, the WHO resolution, hopefully adopted tomorrow, will bring us to do, that it will set clearly what WHO needs to do and what member states need to do to advance this agenda. And so we're kicking off this next phase of the journey now with this great goal alliance, this Global Oxygen Alliance. And we will continue this journey tomorrow in the WHA, hopefully to adopt the resolution. And one of our first actions, and I'm going to say this here because I have the opportunity, is a plan for a national oxygen roadmap meeting that will happen in October this year. And we will invite member states to join us. And what are we going to do there? We're going to allow, like we have here, countries to tell us really what they did during this pandemic, how they scaled up, what innovative solutions they found within all parts of the ecosystem, because there's many elements of the oxygen ecosystem, which I've had to learn, because I'm not an engineer, I'm actually a clinician, I'm an ICU physician. But I've learned a lot about the ecosystem of oxygen and where we have to make interventions on all of it to work together to build national oxygen plans, but not just that, but actually costed plans, and not just that, but actually interventions and implementation, operation, maintenance, and operability of oxygen in our health systems. So with that, we look forward to inviting you to that meeting in October, and look forward to working together with the Global Oxygen Alliance to achieve these goals in the future. Thank you. And thank you to the panelists. Wonderful.
That's your step. Great. Thank you again to our moderators, Adriana and Janet, and to the three representatives from the countries, from Peru, from Chad, and from Nepal. So that concludes part one. We're now going to go to part two, and this is concerning the launch of the Global Oxygen Alliance. We have, to kick that off, a short presentation from Dr. Sarah England, who's a senior advisor to the Global Oxygen Alliance, and in fact led the extensive consultations with multiple stakeholders globally, regionally, in country, in order to inform what the Global Alliance needed to be and how we should set it up. So it's my pleasure to invite Sarah to the stage so she can get ready to start with the opening presentation, after I then bring everybody else on stage. I'm also going to invite the moderator for the next panel, our beloved Maureen Murenga, who is the Executive Director of the Lean On Me Foundation, and also on the communities constituency of the Unitaid board and other important community fora. So Maureen, if you can come to the stage as well and have a seat before we kick off. Now I'll also invite the 5 panelists who will be moderated ably by Maureen. First, we have our own Dr. Philippe Duneton, the Executive Director of Unitaid. Philippe, you can come up to the stage. Then we also have Marika Winmarks, the head of the Strategic Investment and Impact Division at the Global Fund to fight HIV, TB, and malaria. We have Dr. Marcus Espinal, the Assistant Director of the Pan American Health Organization. Welcome to the stage, Marcus. Oh no. You okay?
So I need to have 2 glasses of wine there.
Okay. All right, thank you. And I'm not going to fall off this stage. And last but not least, Christopher Gandrup Marino, the Chief of Innovation in the Supply Division of UNICEF. So welcome, Christopher. So to kick us off, Sarah, take us away.
Thank you, Robert. Excellencies, guests, and colleagues, thank you for joining us today to formally launch the Global Oxygen Alliance. Bonsoir et bienvenue au coup d'envoi de l'Alliance globale sur l'oxygène médical. Who can forget the heart-rending struggle to get medical oxygen to the lungs of critically ill COVID-19 patients? The unmet need for oxygen, an essential medicine that had been neglected for decades, was in everyone's eyes and ears. Out of that crisis was born the ACT Accelerator Oxygen Emergency Task Force. It was a high-impact, agile group bound by mutual trust and a mission to bring the biggest possible benefit to the most vulnerable countries. They moved $1 billion worth of resources for oxygen, brokered breakthrough agreements with the world's biggest suppliers of liquid oxygen, and catalyzed advances in treatment, human resource capacity, and market shaping. The ACT-A Oxygen Emergency Task Force was a true success story. But now, as the spotlight on oxygen recedes and the COVID-19 emergency ends, it's essential to consolidate the gains, implement and operationalize the capital investments, maintain momentum, and at all costs, avoid relapsing into neglect of this vital, cross-cutting health system building block. This calls for a mature and inclusive partnership, supporting countries in generating and implementing costed national oxygen roadmaps that take a systems approach and are embedded in health sector plans. Through a broad consultative process, consensus was built on a mission and architecture for this new global oxygen alliance to address all medical oxygen needs. The new alliance task force retains the members whose trust-based agility ensured the success of the original, but it's now enriched with the voices of those who are implementing oxygen systems in low resource settings. Its leadership is a quartet of Unitaid and the Global Fund as co-chairs, and the regional health authorities, Africa CDC and PAHO as vice chairs. And the quartet is complemented by a strong secretariat comprising WHO and UNICEF. As part of this alliance, and as a platform for country-level implementers and other key stakeholders, including industry, the Lancet Oxygen Commission and its Oxygen Access Collaborators Network of over 100 members provides a means of ground truthing the strategies and products, ensuring that the work of the Alliance is guided by stakeholders from the community level on up. Dr. Kitutu from Makerere University, Uganda, and Dr. King from Karolinska Institute, Sweden, are here on behalf of the Lancet Commission. Commissioners, would you kindly stand up and give us a wave? They are keen to hear your thoughts on a proposed oxygen access scorecard and would be very happy to answer questions and share more about their plans. So please seek them out in the reception. As you join in this launch of the Alliance, I trust that we can count on you to support its objectives: investment consolidation, procurement and market shaping, country-level mapping and planning, advocacy, and demand generation, all informed by monitoring and evaluation based on aligned indicators. Again, thank you for joining in the birth of this alliance and for keeping the momentum going so that children with pneumonia, women in childbirth, trauma victims, and the many others whose lives depend on essential medical oxygen receive it safely whenever and wherever it's needed. Merci beaucoup.
Thank you so much, Sarah. And before I invite Maureen to start the next panel, we must complete the panel. I forgot the Africa CDC. I apologize. Dr. Raji Tajuddin is the head of the Division of Public Health Institutes and Research, and he is representing Africa CDC today. Let me help you up. We can't have you trip over here. Thank you very much.
Thank you very much. First of all, I would want to acknowledge the people who have worked so hard to ensure that we have reached a point where we are declaring that we will ensure oxygen is accessible by everyone who need them and save millions of lives. And I'm really seeing very excited panelists here and very optimistic people in the room. And I'm sure this zeal that we have right now, we are going to carry it to the end. So oxygen. Oxygen is such an emergency. I have survived TB, I have survived pneumonia twice, but it wasn't as bad as I needing oxygen. But in 2021, I had COVID. I didn't know I had COVID because I wasn't feeling any pain in my body, but I was just feeling tired. But it reached a point I couldn't breathe. I kept asking people to open the windows. I felt like I was holding my breath. And then I had to be rushed to hospital. At that time, I couldn't go alone. And then I was diagnosed with COVID. They were calling it COVID pneumonia. And I immediately was to be put on oxygen, and not only on oxygen, I needed to be admitted at the ICU. Unfortunately, it was a peak moment for my country, Kenya, and most of the hospitals were full. So that particular hospital told us to find somewhere else because their capacity was full. And it wasn't only me, I would see a lot of, especially old women, also in the queue being asked to find somewhere else. And everywhere we went, we needed to give a down payment before you got admission. So there are people who died waiting to raise the down payment. I had my family, I had my network of civil society, so I survived, but not everyone had that opportunity to survive. So that really taught me, and my son used to ask a question, but mom, everyone is breathing oxygen, how come you need to buy yours? And then I realized that there's oxygen and there's medical oxygen. And medical oxygen is such an emergency. If you want to know, just try holding your breath. You can't hold it enough for you to find another place to go and breathe. You hold it for a few seconds and you want to breathe again. So we are glad that we are meeting here to ensure that people are breathing. It is really important that regardless of your medical condition, you're able to breathe, because it is only through breathing that you can stay alive. That is what my science teacher told me. So that I don't take so much time, I want to welcome our panelists. And first of all, I want to ask them, each panelist, to take at least 2 to 3 minutes to answer this question. How will your organization contribute to collective efforts to keep the momentum and to transform investments made during pandemic into lives saved? So we are going to start with Philippe. Philippe is the Executive Director of Unitaid. Welcome.
Thank you, Maureen, and thanks for remembering us the reality that you face, like millions of people around the world. And I think that each of us today have a personal story. To be honest, when we saw the situation, when friends in Africa, friends in India, family members, the staff receive bad news, that turns very badly sometimes. And so we had thought before the pandemic, the last time I had actually a trip in Barcelona was to launch the first project of Unitaid about oxygen with staff, with Alima. I remember I was very surprised because we present that during the audience. The audience was very vibrant. I said, there is something there. And the people said, well, we need 1 billion. 1 billion? Seriously? Wow. Today we have 1 billion, thanks for the Global Fund, thanks for UNICEF, thanks for France, Germany, Canada, who support us in that work. And I think that we came from a situation that it was access to oxygen was not a priority at all, at the global level or at even domestic level. And what we find out in the fight with WHO is that a lot of countries didn't have a plan. And I think that's still, I think that the intention, the work, what you all, and also I have to thank Robert and the team working with you guys, with you at WHE, to make this happening at country level, to support that kind of work that, of course, Global Fund now can fund. And so I think that we move the needle. There is a dramatic change, thanks for the work, but we know that more needs to be done. So the same situation, the need to plan for the real needs, and the real needs are day-to-day needs. That's the change. The people, the wake-up call, the nightmare call, I have to say, was during COVID. But in fact, the real need are day-to-day. It was mentioned by many of you. So we need to change the reality. We need to change also from the emergency mode to a more sustainable way to support countries. And that's the reason why, together with the Global Fund, but also we felt that we need to be inclusive. It's not just about Unitaid Global Fund, it's about WHO, it's about UNICEF, it's about African CDC and PAO, so, and the countries. So I think the intention is that, because in a way, you know, there is, I will finish with that. There is a lot of discussion about architecture of global health. Is this very complex? Does it work? What is the change for the people? I think this really, and I can say that because it's a collective effort, we can demonstrate how this works, because we have no choice but to make things happening. And I think I'm very proud also for that. And I will look to more change in the near future. Thank you.
Thank you, Philippe. Thank you for the remarks. We have no choice but to make things happen. That is really powerful. Next, we are going to have Maraike from the Global Fund. She's the head of Strategic Investment and Impact Division. Over to you.
Thank you very much, Maureen. And I remember very well when you were so sick with COVID and how worried we all were for you. So thank God for oxygen. I'm speaking on behalf of Peter Sands, who really regretted he couldn't be here tonight. But we are at the Global Fund really terribly excited and proud and honored to be part of this launch event. Even with the COVID-19 pandemic now officially over, there remain very dynamic times, and countries are transitioning from an emergency response towards recovery and pandemic preparedness, and medical oxygen will play a critical role in that transition. We've heard from previous speakers about the hard lesson we learned from COVID-19, that medical oxygen and respiratory care has been a major and long-standing blind spot in the global health financing landscape, including for the Global Fund, where we have before COVID invested very little in oxygen. And so we really had to rapidly scale up, build our internal capacity and go through a very steep learning curve, like I think many of us at global and country level. And the pandemic really illuminated a shocking vulnerabilities with a lot of countries facing acute oxygen shortages. I still remember the pictures from India. Patients dying from a lack of access of what is an essential medicine and essential health service. And going forward, we really must do better. And what does better look like? For starters, still working? The prospects for sustainable finance. Okay, it works. It will be linked to our ability to demonstrate success of our current investments in oxygen, including the successful installation, delivery, and better clinical outcomes associated with improved respiratory care. For the Global Fund, this is at the heart of why we like the Global Oxygen Alliance so much. Never before have we seen such a massive surge in financing of infrastructure for oxygen supply, for distribution and delivery of oxygen at the bedside. It must be our shared priority and collective responsibility to make sure that all these investments are supported, sustained, and that their public health benefits realized. The Alliance is really bringing together all the key partners, the global actors, the important regional actors like African CDC and PAHO, and organizations that are working in the front line. And one of these organizations in the front line is Building Health International, which is an NGO that has supported the Global Fund to provide technical advice on specification, site readiness, and training in building oxygen plants. A lot of knowledge that we didn't have inside the organization. It really has helped us to maximize the effectiveness of our interventions. And it's, in my view, it is broadened, deepened, and country-facing representation that will be vital for the future success of the Alliance. We're very proud to be part of the Alliance, and with our co-chair, Unitaid, and the vice chairs, PAHO and African CDC, and the energy and dedication of everybody in this room. We're very confident that we can together make the investment case for oxygen by continuing to deliver real life-saving results for people. Thank you.
Thank you very much. It's still about people, it's still about saving lives. And that takes us to Africa. So we want to welcome Dr. Jean from the Director General of Africa CDC. Dr. Jean, over to you.
Thank you. Good afternoon, distinguished colleagues, ladies and gentlemen. My name is Raji Tajuddin. I'm not Jean, but I'm standing in for him. He had to be, he had to join another meeting at the headquarters. Now, having said that, I was listening carefully to the previous speakers, and especially the first speaker, who actually reminded us that a child dies every 45 seconds due to pneumonia, largely because of lack of oxygen. And we also know that oxygen has been on the WHO essential medicine list for years. In fact, oxygen has been in the clinical medicine for over a century, but yet it took a pandemic like the COVID-19 to remind us, the entire world, that 2/3 of people in low and middle income countries do not have access to oxygen. I think this is a question that really need to search our soul. But again, let me start by thanking Uganda, for really standing up, sponsoring that resolution, increasing access to oxygen. And I hope that tomorrow we all gather to celebrate the passage of that resolution. Now to your question. So in the course of the COVID-19 pandemic, the African Union, as part of ensuring that each and every member state of ours have equitable and affordable access to the medical supplies, we did set up what we call the African Medical Supply Platform, which is a pool procurement platform that allows our member states easy access to some of these supplies, including oxygen. Number two, we also procure a lot of oxygen, worth millions of dollars to support a lot of our member states, including what they call oxygen concentrators. We work with the partners to set up PSA to support some of these countries. Number three, we also train a lot of medical personnel from our member states on how to use pulse oximeter, how to use oxygen, but much more importantly, we train people on how to fix some of these oxygen equipment that were damaged, and that was more of game changer in a lot of countries. At the political level, under the leadership of our head of state and government, they did set up what we call the AU COVID-19 Commission. And that commission is being led by President Cyril Ramaphosa of South Africa. And that commission actually looked at how to bring the entire continent of 1.3 billion people, 55 member states, out of the COVID-19 pandemic. But much more importantly, how to restore and repair our health systems. And one of the critical areas that that commission is actually looking at is to ensure access to some of this life-changing equipment, especially oxygen. And last but not the least, we use the opportunity of COVID-19 pandemic to come up with partnership, action-oriented trusted and respected. And on this one, I think I need to acknowledge Unitaid, Every Breath Counts, WHO, and UNICEF. You know, we were able to come up with a coordinated way to support our member states. Thank you, and over to you.
Thank you very much. We need that strong partnership to be able to ensure equity of oxygen access. Now we go to PAHO. Dr. Marcus Espinal is the Assistant Director of PAHO. Welcome.
Thank you. Good evening, everyone, and it's the end of the day, so let's try to stick with time so you enjoy the gift of the French Embassy. Thank you for the invite. You know, one of the speakers, I think it was Atul, said we took these oxygen things as a luxury. But you said in middle-income countries and low-income countries, still plenty of people are not having access to oxygen. The pandemic shows us that, but that's a problem that is not new. The pandemic exacerbated that. So, and now we are acting. And the good thing of the alliance, and I congratulate Unitaid and the others, is that it's not only about money. It's an alliance that brings also technical partners, because we can have 1 billion, but this is not only about money. It's about preparing good plans. It's about conducting technical assessment of the situation in countries, in middle-income countries and low-income countries. It's also about deciding, you know, where we're going to prioritize to make sure everyone have access, because it's breathing. It's a conundrum, it's breathing. We need to make sure we act. In 2020, PAHO, which by the way is the oldest public health agency in the world, created a committee of experts called Oxygen Technical Committee to advise countries. And we were surprised to see after some assessment that this was not something easy to take forward. This needed a lot of effort, and Mike Ryan mentioned plenty of different staff. We have to go to several departments inside PAHO to put together different expertise to advise countries. And you'll be surprised to know, two of the things that I wanted to bring the attention that are important for us to make this alliance a success one. It's capacity building and it's technical cooperation. Capacity building. We produced more than 10 videos about oxygen-related issues. And it was in about 15 days by 50,000 people. We produced several webinars, and they were packed because people wanted to learn about it. You know, because it's not only about providing the gas or the oxygen. And we produce through our virtual campus, because we have a very good tool called the virtual campus, where we can train people online, several courses. This is very important if we want to, because countries need the support to be trained. You have been hearing through the WHO the problem of the workforce. It's a huge problem in Africa, in Asia, in Latin America, and ministers are shouting at us, let's try to solve the problem, because in many high-income countries, they are taking our workforces from middle income and low income, because people migrate, because health workforces, they don't have the best living conditions, and they need the support, and they need to be trained. But the other thing, it's also the technical cooperation. We conducted missions in several countries. We provided technical cooperation to more than 18 countries in the region. And we need the money for that, but we need to produce the normative functions. I mean, the technical documents are vital, because it's not that, okay, here's the money, get the oxygen. No, it's not going to work if we don't do the technical cooperation, if we don't do the capacity building. Thank you. Let me not take more time.
Thank you very, very much. The beauty about this alliance is that it comes with technology transfer and technical assistance. And so countries are not just allowed in the blue with cylinders and oxygen in it, but they are told how to do it and how to do it better. The first speaker mentioned that 10 times of children 10 times the number that is in this room die every day. That's a huge number because of lack of oxygen. And so we want to hear from Christopher from UNICEF on, is it Christopher? Sorry, okay. From UNICEF on what plans they have to sustain this momentum.
Thank you. So thinking back to those days where we talked about that billion and to that event, Lisa, that PATH hosted, that was in many ways our sort of accelerated entrance into the oxygen. We'd just back then gotten a grant together with WHO, working hand in hand with Adriana, from the Bill and Melinda Gates Foundation that enabled us to lay the groundwork for oxygen. After completing that work, very little happened. There was very little, if any, procurement and implementation, and then all of a sudden COVID hit. And because of that groundwork, we were able to very quickly, with all the partners in this room, respond extremely efficiently. So we created a one-stop shop where countries could access all the critical products. We created a global technical assistance team, all together enabling us to truly leverage that country presence to ensure access. Going forward, as per the UNICEF mandate, our priority will be to ensure, of course, especially that women and children have access to oxygen. And for that to happen, we'll need to ensure that oxygen is available at the primary healthcare level. And that extreme decentralization of oxygen is an enormously complex task, where, in all honesty, the physical product is probably the small part of the problem. So concretely, we have initiated a series of activities that we will continue with in order to make that happen. One of these is that we are putting together, as we speak, a market guarantee with the support of Canada for low resource setting applicable concentrators, so to offload the risk of that so that investors and companies will drive these forwards. We are investing heavily in solarization and other technologies to ensure the operational expenses and complexity gets decreased. We have a newly launched app to identify the problems and also working on a heat pump to ensure that the energy produced gets translated into energy savings in the hospital. And then maybe most importantly, we're pushing forward with so far successful efforts in driving public-private partnerships where we're supporting governments in leasing off the equipment and then have private operators take care of these and sell the oxygen as a service into facilities. As an important component in moving ahead, I think we have to remember that these assets that has been put in countries come with an enormous obligation in terms of servicing, and sort of rough calculation says that for an oxygen plant on a 20-year period, where you on a good day can hope that it can continue, we'll have an OPEX that's roughly 10x of the CAPEX, right? So if these plants cost, say, 300,000 to buy, they cost 3 million over a 20-year period to operate. So the burden we are putting on countries in order to sustain this is enormous. And therefore, we need to think much beyond just having the equipment there, but to ensure all these other things are in place. We are extremely proud to be part of GOAL and to be leading the Secretariat, or to be running the Secretariat together with WHO, supporting the leadership of it. And we hope we can continue, not finish, but continue what we started in terms of ensuring this coordinated and collaborative effort to ensure that oxygen is widely accessible.
Thank you very much, and thank you so much to the panelists, and it is so refreshing to see all of you come together, including those that are not here, to ensure that you form GOAL, whose goal is to ensure that nobody dies due to lack of oxygen. Thank you very much.
Okay. Thank you so much, esteemed panelists. Watch your step on the way down. Okay, we're now approaching the end of the first session. Before we go to the reception, though, we have two more brief interventions. We have the ambassador's remarks, and here today It's my great pleasure to welcome Her Excellency Ambassador Leslie Norton to the stage. She's the permanent representative of Canada to the United Nations in Geneva and international organizations in Switzerland. So, Ambassador Norton, please come up to the stage. Thank you so much. Oh, I beg your pardon. I'm going to guide you there. Okay.
There really is an amazing amount of brain trust combined with experience in this room, and it gives me a greater challenge of being the almost last speaker. It makes it quite difficult. So it's Bruce and I, two Canadians, that are standing between you and a cocktail. And it's really not good for my country's reputation, so I will be brief, which is often the kiss of death when a diplomat says that. But dear honorable ministers, colleagues, and guests, I'd like to start by thanking Monsieur l'Ambassadeur Jérôme and the French mission for hosting us and for the warm welcome. I feel very much at home with the very bilingual nature of this event, and I have to say the very cold weather in May. It really is an honor to be invited to be with you here today. As we know, when the COVID-19 pandemic began, countries took action to attempt the slow spread, to attempt to slow the spread of the virus, and together we developed new tools, new vaccines, and new interventions. Canada quickly became a leader in the ACT Accelerator, including as one of the top donors to the therapeutics pillar. From the beginning, we knew how important it was to support a comprehensive response with testing, vaccines, health system and delivery support, and of course, treatments. And as many of you highlighted, it became clear very early on that in the pandemic, that one of the most valuable tools to fight COVID-19 was one that we already had, that of oxygen. But we also know that access was limited in stretched health systems that were strained in responding to the pandemic while also maintaining essential services. Still today, as we've heard and as we know, many countries do not have reliable access to medical oxygen. Yet we know and have heard that oxygen is not only a critical tool for long-term COVID management, it's also essential for maternal, newborn, and child health and disease management. Improving supply and access to medical oxygen within the health infrastructure will stand as one of the positive legacies of the pandemic, as it's being prioritized across health systems. As a leading donor in the oxygen space, Canada will continue to support countries to bolster oxygen capacity through investments in oxygen supply, infrastructure, and workforce. Canada is also proud to engage in the Global Oxygen Alliance to help ensure medical oxygen stays high on the agenda of all countries, governments, decision makers, and partners around the world. With our feminist international assistance policy, Canada is working to ensure health interventions take a feminist lens and actively engage women and children to better address their unique needs. To reach the maternal and child health targets by 2030, it's important for Global Oxygen Alliance partners to work together to increase equitable access to oxygen and other life-saving supportive tools for all. So it's against this backdrop that it's really an honor to be here with you all today to celebrate the launch of the Global Oxygen Alliance and the very important work we're undertaking together. Thank you.
No, wonderful. Thank you. Thank you very much, Ambassador Norton, for those remarks, and in particular for Canada's significant support for the overall global COVID response and also oxygen specifically. I'd now like to invite Dr. Bruce Aylward, with whom many of you know. He's the Assistant Director General at WHO for Universal Health Coverage and Life Course. Bruce, welcome to the stage for you too. Hey, careful. To close this session. Thank you, Bruce. Or you can use this one here.
Can I use this one?
Yeah.
Does that work?
Back to yourself.
Can that be heard back? Yes, it can, back there somewhere. What Ambassador Norton didn't tell you when she said that you have two Canadians standing between you and the free drinks, Ambassador, for the free drink. Thank you, Ambassador Jérôme. Between us and the drinks is that one of those Canadians is actually a Newfoundlander. And Newfoundlanders are of Irish descent. That would be me, by the way. So I'm sure Mike took a little bit of time to introduce. So sorry I couldn't be here right at the beginning. But, and I'm going to take a few minutes just to wrap us up here today. But as introduced, I'm Bruce Aylward. I head up our Universal I'm still learning the words of what I cover, our UHC and PHC agenda. And part of the charge I'll have as we go forward is on taking forward our role in oxygen. And I did want to say a few words about this because, and Mike shared a personal story, if I understand correctly, when he kicked off. And I'll share a slightly more personal story, my story with oxygen. I had the honor to be part of the Ebola response in West Africa back in 2014-15. And when we finally came out the back end of that awful event in 2016, I finally decided to look out for my own health. And what I decided was, well, I was going to get that shoulder that had been bugging me for the last 15 years fixed. So I got that fixed, and it all went well. And 3 days later, I found myself in the ICU at Hug because I had a reaction to one of these, one of the drugs, one of the Atul's here, yeah, one of you surgeons gave me during the course of the event and of the surgery. And I spent a month in Hug, and I spent a lot of that time on CPAP, dependent on oxygen, because, in fact, I had a multi-organ failure as a result of this. And I took it for granted, of course, that there would be that oxygen when I needed it, just like there would be so many other things. And all it took was a little virus, our COVID virus, to hit the world, spread around the world, just to remind me how lucky I was that I had oxygen. But in the same ICU where I spent a month, many of the people who followed, frankly, couldn't get enough oxygen fast enough. And if it wasn't because of the oxygen supply, it was because of the technical machinery, of course, that had to be behind that supply. And we had a tremendous wake-up call during COVID-19. And it was terrifying what happened. We saw the terrifying images. Yes, we were waiting for vaccines. Yes, we were waiting for new therapeutics, but we couldn't make something as simple as oxygen available to every people around the world. And the real tragedy, yes, it was a tragedy what happened in COVID, but the real tragedy is that it took COVID to wake us up, because so many people, and we heard so many speakers refer to it this evening, we need oxygen as so much of what we do in delivering clinical care, and so many people suffered way outside the spotlight that COVID shone on this problem for so many others. So so important what happened with COVID, but I think what was even though we often stand up and we talk about how awful that was, the response was extraordinary, and I just want to recognize so many of you here today. I had the honor to lead the ACT Accelerator, as many of you know, during the COVID response to try and support Mike and all of the work that people were doing in the response. But one of the things that we were trying to do was scale oxygen, and I think some of the real heroics that we saw in that response, in the Oxygen Emergency Task Force. I always did I get the order right? I always get the order wrong. Thanks. But real heroes like Robert, who I hope people have clapped for throughout the evening at various times, and so many others. Because so many people stood up and we saw extraordinary work on what was a very complex problem, right? Everybody was saying for so many decades, oxygen is really complicated. It was complicated, but the response we saw, technical guidance super fast. We saw technical specifications coming out super fast. We saw innovative solutions to try and make this oxygen go as far as it could. We saw extraordinary role of the private sector. Is the private sector here tonight? Some of the people who've done this great work. Oh, there we are back there. Huge thank you to you for stepping in. I'm being very careful not to name any companies here, because whoever you work for is not going to be the one that I name this evening. But thank you for all of the partners who stepped in. And so we had a tremendous response, and then we saw a tremendous effort, and really led, I have to say, and thanks to you, Philippe, for the effort, you and your organization, along with the UNICEF, of course, such a big partnership that worked with us, and the Global Fund and others, and my own organization. So I'm only going to name the international ones. But so many of you came together to help make that task force a success. And, you know, it was some terrifying images early on. And then as we started to wrap up, not wrap up the ACT Accelerator, because we'll keep going, right, until things have really quieted down. So we've got a ways to go forward. But as we came out the back of our transition period over the last couple of months, I started to have a new terror. At the beginning of setting up ACT Accelerator, I was terrified. How the heck are we ever, going to step up to this challenge? Are the partners going to come through? Everybody did. But a couple of months ago, there was a new terror, right? And that was the terror that everything we'd built was going to start to dissipate and dissolve and disappear. And again, this is where I just want to thank everybody who's come together, and especially thank France for hosting this event and reminding us all how important this is. Because what we've now, this awful crisis has given birth to a great initiative, and that is the Global Oxygen Alliance. So I just wanted to finish the evening by saying we've come an extraordinary distance in a very short time over the last couple of years. We have a huge distance to go yet, but when you see a full room like this in here talking about oxygen, the solutions, that it's doable, I'm going to sleep a lot better tonight for one thing, and I won't be taking oxygen for granted though, but and neither will I take you for everything you're contributing to this. So finally, just a great thanks, Ambassador, for hosting us in this absolutely gorgeous environment this evening, where we're going to enjoy, I'm sure, some wonderful wine. I nearly said French wine, but I almost said that the other evening. Of course, we drank Swiss wine. But with that, folks, hopefully the second Canadian won't delay you any longer. But last thing I will say is, just as much as you are all committed, our organization and everything we can bring to this, we are fully committed. The World Health Organization, we started with our Executive Director for Emergencies, and we're closing out with the UHC ADG for a reason, right? We're trying to send the message, if it's not completely obvious, that it's right across the organization. We even have some of our legal team in the middle of the, we can't do anything without our lawyers, as you can tell. And they keep an eye on us, as you can tell as well. But it's an all-of-organization commitment to this agenda. So thank you very much. Thank you to our hosts. Thank you, Ambassador Norton, for your comments just beforehand, and to all of our speakers.
Watch a step, huh? Thank you very much, Bruce. I'm actually Kenyan and Canadian, so you can't blame the third Canadian for holding you back from the reception. But I do want to invite His Excellency, Mr. Jérôme Bonafont, who is the ambassador and permanent representative of France to the United Nations and international organizations in Switzerland, who will welcome us for the second part of this evening. And thank you, Mr. Ambassador, for hosting this event. Thank you.
Merci beaucoup. Les Canadiens ont parlé anglais, donc le français va parler français. Puisqu'il faut bien être bilingual, n'est-ce pas? Après l'effort, le réconfort, disons-nous en français. Donc il y a deux sortes d'ambassadeurs. Il y a les ambassadeurs qui travaillent, comme Leslie ou comme Anne-Claire. C'est la nouvelle mode. Et puis il y a les ambassadeurs old-fashioned comme moi, qui ne font que du cérémonial. Donc, ma mission ce soir, c'est de vous inviter toutes et tous à venir prendre un peu d'oxygène pour l'estomac, sous la forme de foods and drinks, que j'espère de bonne qualité, mais aussi de remercier énormément Unitaid et la nouvelle Alliance globale pour l'oxygène, car il est vrai que c'est un sujet capital. Vous voyez, pour nous, la santé mondiale, c'est 4 choses. Nous disons tous, nous sommes interdépendants. Si nous sommes interdépendants, nous devons être solidaires. Et à Genève, la responsabilité du pôle santé mondial, c'est de se montrer efficace, cohérent, pragmatique et visionnaire. Et pour cela, nous avons le cœur du système, le cœur du réacteur, qui est l'OMS, et nous avons tous ces satellites extrêmement importants que sont les fonds et programmes autour. Quelques-uns ont été perdus à Washington, à New York ou ailleurs, mais enfin c'est Genève le cœur. Et que faut-il faire? De la norme, de la norme, de la norme, pour dire ce que sont nos règles communes. Le règlement sanitaire international, le prochain traité sur les pandémies, les grandes stratégies. Deuxièmement, de l'argent, de l'argent, de l'argent. Les fonds, tous les fonds qui sont principalement ici, mais aussi dans quelques autres endroits, et l'alliance des fonds pour financer tout cela. Troisièmement, il faut évidemment des programmes. Et l'alliance, ce sont des programmes, ce sont des moyens par lesquels nous arrivons à mettre en place des choses qui vont marcher, qui vont aller jusqu'au dernier kilomètre. Et je voudrais rendre un hommage particulier à Unitaid parce que c'est là, comme dans une sorte de start-up associée à l'OMS, que l'on imagine ces programmes un peu novateurs qui sont ensuite démultipliés. Et puis enfin, il faut une gouvernance fondée sur la science, il faut une gouvernance fondée sur l'expérience médicale, il faut une gouvernance fondée sur l'expérience. Et cela, l'OMS sait le faire et sait être le coordonnateur de cette gouvernance avec ses niveaux politiques et ses niveaux techniques. Alors tout cela, nous devons le faire ensemble et je suis heureux de voir que vous avez tous accepté de venir ici ce soir pour cette longue séance de travail sur l'oxygène. Donc j'ai assez parlé et je vous invite maintenant à vous réoxygéner de l'autre côté. Bravo et merci beaucoup.